In 2012, the Supreme Court held that states were not required to implement an expansion of Medicaid mandated in the Patient Protection and Affordable Care Act. State lawmakers were faced with a choice: expand Medicaid to cover able-bodied working-age adults with no children, or reject the optional Medicaid expansion. 25 states initially decided to reject it. Now, these states are facing increased pressure to expand Medicaid under Obamacare. But a growing number of physicians and concerned citizens know that Medicaid expansion will come at a much higher cost than its supporters are willing to admit.
I was elected to the school board in 2011 and have been on the school board for just over 2 years. I'm an advocate for our public schools. I want teachers, parents, and students to be successful.
As a doctor, I know that it is my responsibility to care for my patients. It means that you are doing your Hippocratic oath. You care for the downtrodden, and when you care for those that are uninsured.
I decided to be a nurse when I was 5 years old. Nursing is one of the most demanding jobs you can ever do, but it's one of the most rewarding jobs that you can do.
I decided to become a doctor when I realized that what I wanted to do with my life was take care of other people and make their lives better.
Every year that I've been on the school board, we have had substantial cuts. In fact, one year we had to come up with $4.5 million worth of a cut. That's a lot of money. People think that Medicaid expansion is for children. It's not. Kids in Virginia are already covered. We're talking about 400,000 non-disabled adults over the age of 18 who have other choices and options. Kids don't have those other choices and options. The money will have to come from somewhere, and it will come from education.
Yes, when I was still in practice, I accept all insurances. I take care of Medicaid. I know that I will be paid less, but it doesn't bother me because that was my duty as a physician. More and more doctors now are shying away from taking care of the Medicaid patients. And I know what Medicaid expansion will do. It will just increase the number of these patients, but then no access to physicians.
Medicaid expansion will hurt nurses because it will hurt our patients. I fear that expanding Medicaid will result in poor quality care. Healthcare reform is going to change the way nurses take care of their patients because honestly, we're going to see a lot more unlicensed assistive healthcare personnel and a lot less registered nurses taking care of the patients.
I personally have never turned anyone away, no matter what they had. They didn't have insurance, they were self-pay, they had Medicaid, Medicare, it doesn't matter. The problem is becoming, as we expand Medicaid, that the reimbursement for Medicaid is so much less than either private pay or private health care insurance that as of now, 1/4 of all primary care physicians do not accept new Medicaid patients.
I used to think of Medicaid as a compassionate program, but when I found out all the abuses, both on the provider and the patient side, I lost hope. Medicaid expansion is not the best way to take care of the uninsured.
The Medicaid expansion will crowd out everyone else who's looking for health care. And so the people who have disabilities or who are extremely poor or just barely making it will not be seen. They will not get the good health care that they're getting today.
I cannot support the expansion of Medicaid because it will hurt public school funding and ultimately public school students.
As a doctor who has devoted a good amount of time in my career helping the poor, I cannot support Medicaid expansion.
I cannot support Medicaid expansion because it does not provide better quality health care.
I absolutely cannot support Medicaid expansion. Medicaid expansion is bad for patient care. It will not improve the quality of medical care anywhere for anyone.